uh, are are really needed for very ill children which suffer conditions from heart or from anything else. If we put now children onto them which suffer from severe COVID conditions, it will lead to a lot of children not being able to get their treatment which they need. And this is a big problem. We now in Germany, for example, have the situation that the vaccination is allowed for children above 12 years. It is not yet open for children under 12 years, but the problem is other countries have given it free for children under 12 years, and the data we have until now shows it is safe. There is no problem we can expect from the vaccination which would prevent vaccinating your children under 12 years. The only things which can prevent you from getting COVID at the moment are distance, wearing a mask, avoiding gatherings, and hygienic, keeping your hygienics. And that is the main thing which you can follow. Vaccinating does not keep you from getting COVID, but can keep you from getting severe COVID. And with that is meant your risk of getting severe ill and having to be on an intensive care unit or even die from COVID is very low with the vaccination. It was the lowest with the first wild type COVID. With Delta type, which is now mainly around the world, it is lower, and perhaps you've heard of a lot of people who get ill, even severe ill from COVID with Delta type in spite of being vaccinated. But the main outbreaks at the moment are under not vaccinated people. The problem is globally. The global problem has different reasons. In developing countries, we have a lot of problems from even getting vaccines. They don't get the vaccines from developed countries and are urging to get vaccines. In a lot of developed countries, we have people, science deniers, and other kind of people who think vaccines are dangerous, or even vaccines will kill you, give you a chip or whatever. And so they are fighting against getting vaccinated, which from my point is okay if they don't want to get vaccinated, so let them, but they are spreading misinformation about it. One example is we had just yesterday in Germany, in Cuxhaven, in the north, a 12-year-old child dying after getting the second BioNTech vaccine shot. That's a very sad incident, of course, but this child had a severe heart condition, precondition, and it's not clear why it died. And still, the risk of dying from complications from the vaccines are around 1 to 1 million, while dying from COVID, even for children, is the risk for children from dying from COVID is around 1 to 80,000. So the risk from dying from vaccines is very, very low. but still, this is what you read in the newspapers, and you don't read about a child again died from COVID. So for the developed countries, we have to fight against misinformation, and we have to fight against misinformations that lead into the political decisions. For example, in Germany, we have a lot of countries, a lot of governments that open schools and let children without masks in the school. This is very dangerous because until now, masks are our best protection. The problem is if you have a child that gets his COVID infection from school, this will affect the whole family. The whole family has to get quarantined, can't go to work, perhaps gets ill even if they're vaccinated. Perhaps in the family there are members with severe preconditions, with risks to get severe COVID illness, and this is something that the politicians seem not to understand or not to think about. Even the risk of the children getting severe COVID illnesses, and last not least, the teachers and the school staff, which are also in a extreme danger if you lower all precautions that we have. So what the most important thing you can do and you should do to prevent your family to get it is wear masks, keep distance in everyday life, avoid gathering, and get vaccinated. Even your children should get vaccinated, especially when they have illnesses or preconditions that could lead to severe COVID illnesses. So far from me.
Thank you very much. So we all face a problem that family members might get hospitalized or die on their health, or their health is severely damaged by post-COVID diseases. So now I just want to share a picture. Just a second, because then it's a bit more easy to understand what I'm talking about. So even when there's this asymptomatic or mild COVID infection, it may happen that a healthy family member turns into a clinical vulnerable person because he gets, for example, diabetes mellitus type 1 or long COVID or something like that. And so if we think of these green circles as households or families, and the ones with the red mark are vulnerable family members, then one family after the other will get vulnerable. If we go from one infection wave to the other and have new variants, and even if one of the clinical vulnerable family members die, these families are very likely to stay in the group of families who have a clinical vulnerable member, because of course when your parents or a child dies, this causes depression and maybe health conditions. And if it is likely that COVID-19 rips through the whole household, and therefore there's a risk for long COVID, which even can happen when you're vaccinated. If you get a breakthrough infection, then you can get long COVID. And when you have the precondition to get it, you get post-COVID infections. Please let me do this. So from wave to wave, more and more families are with a vulnerable member. And this leads to the idea that at least all families one day will face the problem that they really need to keep distance and to avoid further infections. But unfortunately, there are many families who are not aware of this yet because they don't know the burden of a chronic illness. And this is some kind of insider knowledge, it seems. People who don't know how it is to have a chronic illness often think that, if I'm ill, I go to the doctor and there's a treatment and there's a cure, and maybe there are things that help, insulin pumping or anything like that. And they don't know that there are very, very many rare diseases, and that especially if you have a new disease, then you often get no treatment. Or the treatment is not, it doesn't heal you. You have to do the treatment all your life, and slowly, your body gets damaged. And you have to, you have to fight for participation, and you have to fight to go on with your life. It's not that if a child is not dying, there's no problem. Families who are aware of this are warned and are highly motivated to avoid COVID-19 infections. Other families are rather motivated to get somehow easy through the pandemic. The society expects from all families simply to take the risk of COVID-19. They have to send the children to kindergarten and schools, and there the mitigations are very low. And if you really want to avoid these infections, you have to find a way not to go to school. But the pressure to do so becomes higher and higher, because society expects really that that you go to school and that you go into the kindergarten, and that caregivers give the kids a chance to get education, to meet their friends, to meet their peer group. And if you can't assure that, then yes, the staff of schools and kindergarten and the youth welfare offices and the pediatricians and everyone is asking you, hey, what are you doing? You have to care for this. You have to make sure that there's participation. And if you can't do that, we are going to help you. But the problem is the help and the support that is offered is almost in attendance. You have to go somewhere, you have to meet people who could be possibly infected. And so the pressure is rising, and the problem is really that the policies youth welfare offices are working with are made not for a pandemic situation. They are made for a situation where it is really safe to go to kindergarten, to go to school. So this is a fight of parents who see the need to keep their children at home. There are schools in Germany, or there are countries in Germany where the schools are even they have to provide distance learning, and many schools do this when there's a need, but in nearly all schools have the goal that these kids come back to attendance and don't stay in distance learning, because it's extra work. It's difficult because all the schools are made to have the children at school and not at home somewhere in distance. And a big problem in Germany is really that online schools are not accepted. There are online schools where these children could go, and this would really solve a lot of the problems, to meet peer groups and to know your classmates. For example, my daughter is now in distance learning, but she doesn't know her classmates. There are 31 classmates, and she knows only one because it's our neighbor. And all the others she never can see because it's not allowed to show the whole class. And she told me she would prefer to go to an online attendance school. And I had to answer, well, I think so, but you may not. It's not allowed. So now I have lost my. I just have to check where I am. So what they do is they ask the people to care for the participation. And so participation, I must really say, it's a bird that might fly away. If you send your kids to school and they bring home a COVID-19 infection, and you have bad luck and the child gets severely ill, participation is gone. Because then your child is at home, can't meet her peer group, can't learn, and so this is not the solution. So the solution for now is to go on, and now Simone will tell us about so the solution. One solution is to make yourself an emergency suitcase. And you could put into this emergency suitcase, which you always can open when you have the feeling, it's enough. I can't go anymore. I give in to the expectations of society. I send my kid to school, to kindergarten, whatever. We take the risk. And if you don't want that you turn, you can pack a suitcase and you can put the message of Dr. Mamawa in, and you could put the message of Simone in. She has a message about our human rights, and we want to hear it now. She is a community activist, and engaged in the WHN.
Yes. Hi. I was the Robert Koch Institute, the most accepted scientific institute in Germany, which advises what to do in the pandemic, states in the end of October 2021 that everyone should reduce their contacts again because incidences are getting higher and hospitalizations are on the rise. They should ask us how to get over this time well together by behaving like that since the pandemic began and how we can network and socialize even when we are careful and consequent. Berta, can you mute yourself, please?
Yes, I can.
Yes, we are distancing since the pandemic began, and I want to talk about social participation. And I start now. Our children, they have the right for social participation. Everyone knows that, but they cannot use it under the premise of contamination. And I looked at the Convention on the Rights of the Child from the UN. There it says in Article 31, all children have a right to relax and play and to join in a wide range of activities. This is just the short article. You can look it up and read some more things. They have the right to participate in social contexts, but they cannot at the moment. And Article 6 in this convention says, all children have the right to live. Governments should ensure that children survive and develop healthily. That's the reason why they cannot take part in social contexts now, because they risk their health. So these both articles stand against each other. And yes, I will stop the sharing now. These rights stand against each other and push our children and our families aside from society. Therefore, we build our own networks to stick together and give our children the feeling that they belong to some community. And this gets more important after nearly 20 months of the pandemic. For consequent people, it's very important. I feel this very much, that the people build more networks and now for the children. And I want to give over to Jeanette now. She will talk about digitalization and online possibilities for this. Thank you.
So, okay, I just want to share some slides.
Can you move to the seat in the left?
Yeah. Wait 1 second, please. So, to the seat on the left here. Here. Okay. Yes. Okay. So. Can you see the slide?
Yes.
Okay, thank you.
Yes.
Okay, the topic is chances of online and hybrid offers. I think that's really a key for the pandemic. And it's about solidarity, sense of community, and belonging for children and families. And I want to start with a quotation. Tell me and I forget, teach me and I remember, involve me and I learn. And I think involving is very important for adults and especially for children. So instead, to promote togetherness during this pandemic in Germany, the discussion was and is mainly about risk groups. And the people still think risk groups are very old people and are very sick. So other countries talk about togetherness, like New Zealand and China. I have good connections to China because I lived there 5 years, and it's really, I love to be on WeChat because they talk in a different way. And although they have 4 weeks of quarantine, they're more happy, I think, that, or I have the feeling, than we. So this common sense, this togetherness is really very important. And also the opinion about children is that they won't get ill, or if they get ill, it's not too serious. And that's, the numbers are rising and the people still think children are safe. So the need to change something for children and their families wasn't, and still it isn't high. And also digitalization and safety in kindergarten and school wasn't, and still isn't, not too high. We talk nearly 2 years about digitalization and safety, but in just small steps, there happen things. And now it's getting colder. There are more diseases around. And people are sitting more together. We don't go out for barbecue, we meet inside. And the rules are getting more relaxed also in kindergarten and school. Although we know it's now the disease time, and the families are getting really happy when they talk and say, oh, the children don't have to wear a mask on the place. And if you talk to institution, they say, yeah, when the numbers getting higher, we talk to the other institutions, they have to wear a mask again. But now it was getting less safety. So also families who can offer their children a safe home by using online offers often got problems that their children have to go to school, or that the online communication isn't too good. So families have really a pressure who need to be protected or want to be protected to go to school, what Bertha also said. So just in times of lockdown, it was okay that children can stay at home. So just if all stay at home, it's okay. And at kindergarten, there were only very limited online offers. I don't know any online offer. Now, what was and is possible in my situation, for example, so at the beginning of the pandemic, we were lucky because we have our friends from the time in China all over the world. And we were used to communicate with Skype, WhatsApp, WeChat. So we made online baking courses, online parties, the children played Lego together. So there was a sense of community. Because in Germany at the beginning, I didn't know we were really, a risk group. And then after joining a group for people with higher risk on Facebook, we found a family where we can meet outside, and also we can make in German online meetings. And we also found singing and reading online classes, and also activities from the museum. But always when there was lockdown, there were these activities, singing, but when it's when the lockdown was over and the numbers were getting better, they stopped. So we were lucky because our Spanish friends gave us a link to a US online school. And for our daughter, it was really great because children worldwide can join. There's a flexible timetable. There are different courses like baking, singing, dancing, circle time, the whole time. And there are small classes. And the children can see each other. They talk to the teacher. And they are very creative. And so it's easy to reach the children. So this gives an evolving integration and innovation. And positive effects of online and hybrid offers during pandemics, because you can also say, okay, some go to school or kindergarten and some stay at home, because some really need to go to school. It's esteem, togetherness, you get a structure, it's a safety for those who stay at home, and those, if just a few go to school or kindergarten, it's more safe also for them. The children feel welcome, innovation. And if they have hybrid kindergarten, for example, they can join circle time. They can come back to kindergarten after a lockdown or a longer time, and they know each other. Or if they go to school, the school is normally next to the kindergarten, they know the other children. And also they have more time for other activities. And in the afternoon, they can meet their friends in real time. So they can also have connections to other, but they can have their safe meetings. And for those who need more support or can't learn at home, there's enough space. And luckily, we have also an example for an online offer in Germany. Simone started to make a German Morgenkreis, and perhaps she wants to talk a bit about this. So I will stop the sharing. Simone, do you want to talk about the Morgenkreis?
If not, we can go on. Simona? Okay. So
Okay.
the point is that if the countries and the state and the society make no offers which are in distance, we have to create our own activities or join offers which are provided in the United States or somewhere around the world.
Yes, I wanted to talk, but I couldn't because I was down the line.
So now you can do this.
Yes, okay. Can I go here to the speaker's place? Okay, then I talk like this. Okay. Yes, we have a group since 1 year, and through this group we can reach people. Did I share the screen? No. I want to share just the link to the group, and Beata is also an admin, and Janet is also part of this. Oh, wow, my first PowerPoint presentation. It's a bit confused. This is our Safe Circles group. I will close it. And we meet people there, and they can connect and get to know each other. They will write down where they live and can get in contact and meet together in safe circumstances. We do it mostly outside because if you want to meet someone safely, you need 14 days of quarantine, really, or PCR test also. And therefore, we meet outside with masks, and everyone is doing it differently. And what I was thinking now, after all this time, my child isn't going to kindergarten, and she was happy till now, but we need more to bring the children together and not leave them alone, because they also sometimes have no sisters or brothers, and they are only with their parents and maybe grandparents. And therefore we started a morning round for the children online, and there we sing and dance, and it's a meeting point for the children, and we want to go on with this by not only for kindergarten kids but also for older kids. Maybe we can create something together, and I don't know the word in English, basteln. Do something with your hands, like create what children do, and they can learn from each other some things, they can chat, and that's what we want to do more now, because after all this time I don't know how to socialize with other people, because we are in a form discriminated everywhere we go with masks, and the children especially with masks. We are getting weird looks. Why is the child masking? And like we are torturing our child. It's not easy. You have to be very strong and self-confident to have this attitude and stand behind it and protect yourself and your family. It's not easy when you are like an outsider. And even in our own families, we are separated from the grandparents when they meet and make party. And so every family like us, we are many families worldwide, I know, we are left alone from society. And therefore, I was referring to the human rights. It's against human rights because children have the right for participation. Even us have the right for participation, but it's not that important. For children, it's more important. And so we build our own networks, but it's not easy really, but the WHN gives us the possibility, and also the groups on Twitter, Facebook, everywhere. We have it in every country, and we should stick together more and also say to our countries that we have the right to participate, but we cannot do it when there are no safe conditions. We can't participate, but it's a human rights question. That's what I wanted to say. And if you are interested in building up the connections more and talk about ideas, what we can do online with children, how can we reach more people, you can come to the WHN and refer to safe circles, the keyword safe circles, and then we can meet and connect and talk about it. Because no one has to be left alone. That's our aim and goal. Thank you. I don't know if Berta, do you want to say something, or should we open a discussion about it?
Yes, we want to open the discussion. I just want to say one sentence. Can you hear me?
Yes.
Okay.
Yes.
So it would be great to have safe areas like a big forest or a park where everyone keeps distance and wears a mask and gives each other time to put their masks on, or a safe house where we could meet and go on holidays or anything. So if someone has this and could help us, this would be great as well. And now I would like to open the discussion. So if you...
Now she cannot talk. When you are down, you cannot talk. Okay, then does someone has to say anything to our topic? I mean, the main topic is a bit, for me, social participation, also isolation, but I don't want to frame it in a negative way. I want to see it positive and empower us, and that we stay strong, and we have to get over this time. Now 3 months of winter are coming in our country, and we have to stay strong and be very consequent, more than in the summer also. Maybe. How do you live with your families, and how are you doing it? For example, me, I just give an example. I live near my Schwiegermutter, the parents of my husband. They live in the same house, but we cannot meet them. I cannot send my daughter to them because they are not vaccinated, and they meet other people and children from school, the other cousins from my daughter, and they don't care about COVID. So my child cannot even go into the same house to their grandparents, and the other grandparents also go on party, holiday, etc. So we are totally left alone. And how can we meet people? It's like that. And we are glad for every socializing chance we have. We meet outside with masks, and we are the only ones with masks, but that's it. And yes, it's a bit a problem, but we stay strong, and we are not unhappy, but of course my child has wishes. She wants to make party with other people again. That's the biggest wish she has.
For me, one of the main problems is that in the discussion and in the political culture, it's always shown as if they are only the both extremes. Open everything, everyone can do everything, or everyone is locked in at home, and there's nothing between these two extreme points. And I think that's a problem, because if you talk about having safety, and if you talk about having distance and not having big gatherings, you are always told that you're panicking and you want to lock everyone in his home for a long time. And that's not true. We don't have only black and white. We have a lot of possibilities in between these two extreme points. And that's, in my point of view, that's very important to come up with. If someone says you want to lock down everything just because you're talking about safety. Talking about safety is not wanting everyone to lock down forever at home.
Yes, finally it ends into this. If the safety precautions are not used, if you make the schools unsafe by removing the masks at the place, having no filters, then not all children can go there. And if we would have more mitigations, we could do more. Somehow the functionality of the room is moving.
For me, I see the main chance in meeting other children outside, because everyone is going to school again, most of the people, or to kindergarten, and I regret most of them don't care about COVID for children and prevent it. And we cannot meet them inside, and therefore we only meet outside with other children. And the best is when we find safe circle buddies, when they are also not in kindergarten or school. And we try to reach out for them since over a year now, but it's hard to reach out because everyone is laughing at us. And it's about fear also that COVID deniers will attack us. I mean, I long time used a fake name when I was in articles in the newspaper. Some was an interview, but I never used my real name because I was afraid. And now I think, no, I show my face, because what do I do wrong? I do nothing wrong. I follow safety measures in the pandemic, and also for my child. But it's very hard to find other people because we have no forum in the society. The state doesn't connect the people. Even if they are on school together, 6 people from vulnerable groups, they don't know about each other because they are not allowed to tell the parents that they exist. And that's a problem. If we knew about others who took their child out from kindergarten, we don't have to do it on Facebook all the time. Look around for other people, but we have to do it in a self-help way.
What really makes me sad sometimes is that we seem to have given up on the idea of making schools and kindergartens safe, in Germany especially. For example, my parents came from Iran when they moved to Germany in the 1950s and 1960s. So I have a view on Iran. Even Iran, the Islamic Republic, and I think I can say that openly, the Islamic Republic, who does not care about his own people, even they have filters, air filters in their schools. They have plexiglass boxes to separate the pupils from each other, to enable a school education. And if a country like Iran, where human rights and the rights of the people is not interesting for the government, if they can make it, why can't we? Why can't we, as a developed modern Western democracy? Why can't we do that? That's something that really angers me a lot.
I mean, they now offer, they say after the pandemic, they say it in the media, after COVID now, children have to meet again. We have to do something for the children. They offer them so much activities, swim courses, singing courses, vacation for children, but the pandemic isn't over. I mean, if I read things like that, it's hypocrisy what they offer to the children, really. And children don't know about it. They are not aware of the dangers, and they send into these activities and they frame it like it's good for the children. We have a heart for the children, but it's not true. They have to do it in safe circumstances and not behave like the pandemic is over. And it's also excluding our children, all the children who are aware of the dangers and the families. It's totally excluding these people, and this is separating all the parents, all the people in this country. What the state is doing is separation between the people, and we try to get connected somehow again. Maybe we are hurt. I called my mayor and I told him the situation. I want to talk about with other parents in my city, but they only focus on the now we can open it up again. That's the only thing they do.
I think there's not enough fantasy to use new ways to do things, and there's not enough fantasy what it will mean if really all children get infected, and what it will mean in 5 years to the society.
But I guess, can I say something? That they figure out that, the doctor was saying, that one child in 80,000 it's nothing, and also that long COVID is not so prevalent, which is obviously not true, because it is. And in general, the atmosphere of risking is not something that children should be exposed to. And as for online learning, even if it works very well, it's a great option, but in the long run, it cannot replace normal social contacts. So safe circles are really necessary, because with time, I mean, it's okay for a few months, but now it's too long. It's prolonging, and as an alternative, I mean, it would also be different if even with online learning, but after school, that the kids could meet with some other kids, right? Because school is one part of life, but then you have the other part of life. But if everything is just virtual, then of course it is affecting the children, and that's what the policymakers and politicians are using against online learning and against closing schools. But on the other hand, this is one of the measures to lessen or end the pandemic. So that's what we need, actually, right? I mean, that would be the optimal thing. And then there would be no talk of online learning, of virtual learning, of isolation of kids. This is happening because they cannot provide the proper tools to curb the transmission and end the pandemic, simply, or eliminate the virus.
That's exactly what we are talking about. The main problem is that the deciders don't want to offer safe schools, and they may have different reasons, from not wanting to spend too much money up until to not wanting to know about the dangers of COVID, or ignoring the dangers of COVID. There's a wide variety of reasons for the politicians, and that's the main problem. I mean, we have to deal with politicians who say children are not in danger. And we all know that science does not provide this. The scientific data shows that children will suffer and suffer from long COVID, and we don't even know until now the long-term damages which can appear. We perhaps in 10 or 15 years, we all will be shocked to see what COVID survivors or people who had COVID, even children, will have for damages. We are fearing a real pandemic of diabetics, or a pandemic of renal failure and dialysis patients, and that's all something we have to wait for. And in a few years we can say what happened and what dangers are with the long COVID, but the politicians do not think about this possible dangers now, but they have to think now about it. And not having safe schools is our main problem, because if we had safe schools, safe kindergartens, and the tools to reduce transmission of COVID, then normal daily life would be more possible than now. At the moment, we are running against a wall again and again and again, and complain about our headache. That's ridiculous.
But these safe kindergartens, for example, my daughter would be so happy. You have to build it on your own. Small kindergartens where you are sure with other parents what the measures would be, like PCR testing, and everyone reduces the contacts outside and play with the children from the kindergarten. And it's not possible to meet safely in the kindergarten. Therefore, you need an own community or a small community to do it. It's, in my opinion, like that. You cannot rely on statistics that it won't happen to your child. It's nearly safe. It has to be 100% safe for every child and everyone. So I don't know how to do it. I would be very glad if we enforce this process.
And I really don't understand the Germans, because from China we have a lot of connections to other children. And a Spanish friend of my daughter, she went from Berlin, where she was not happy, to Spain. They have a very good vaccination, quote, and they have masks in kindergarten. But the children are quite happy, although they have these masks. Here, if I would say to wear a mask, they will all go crazy. So her friend, and she's really wild. She's a wild child, but she's so happy to meet the other children. The parents are so happy that the children don't catch COVID. They know what they're really looking for their children. So there I would let her to kindergarten, or also in China. So I don't know what in Germany is the problem with this mask or distance and those things.
From a German point of view, I hope you can hear me. Hi, Henning here from Berlin, Germany. I think we are muddling up with the political things behind. We had an election for the parliament this year, and the year before we got slightly mad on the politics dealing with the right-wing parties. And I think that's bringing in things that does not depend on the pandemic, but we have to deal with them. I'm parallel in a conference of the Federal Joint Committee with that is the second important agency for healthcare system things in Germany, and we had discussions there and presentations on the questions, and it's you can go mad because they don't like prevention. And many of you heard the examples from Sweden, how good they did. Whom of you did know that in Sweden in 2019 they brought air filters in any classroom? They did in 2019 as a reaction of the influenza pandemic they had in the year before, in 2018, 2019. And the reaction was to bring in air filters in every classroom. So any guy talking about Sweden as a good example talked about it because they did nothing. And that's quite not true. They did everything because they had smaller classes. They had air filters in any classroom, and they wear masks too. So they did all the things they could do in before.
Oh,
and that's quite
online.
funny. If you read about it, you will find out they have air filters for 2 years now. And I think that's quite the problem, to say why don't they want to have preventive measures? And that would be easy and cheap. And if we all would do the preventive things, we would get out of the situation and it would be safe for the children. As Simone said, I think it's not a solution to split up the children in small special groups in the kindergarten and in school. I think it's not working. They have to say, make prevention, and we know what to do. We need masks, we need air filters, and we need vaccinations. That's quite easy.
Oh, we have to go now and leave the others here. Sorry, Pedro wanted to say something. I don't know if we just have 30 seconds, but I don't want to disturb. The other session is starting now.
Yes, Simone, I'll be real quick. Sorry, Henning, I just
Yes.
wanted to... You guys hear me? Can you hear me?
Yes.
Yeah, safety practitioner here. I work with aviation. I'm a flight safety officer, and I happen to have lived in Sweden for the beginning of the pandemic. I'm a father of two, and I just think it's a bit problematic, Henning, to be praising Sweden for what they've done. I actually have followed the debate in terms of air quality, carbon dioxide monitors from the beginning. I'm a big believer in that. I'm trying to implement that at work and at my kids' nurseries. And, having witnessed how the Swedish Public Health Authority did, very little in terms of contact tracing, having known multiple kids who got sick and brought it over to their parents in Sweden, I would be a little bit cautious about hailing Sweden as a model in terms of, I'll confess that I was not aware that in 2019 they've implemented air filters. I did not know about this. But considering how much harm they've done globally, namely through the Great Barrington Declaration and Martin Kulldorff, I'm just a little bit uneasy to hear, Sweden being praised here. But that's all. Thanks very much.
Thank you.
I just want to say that I agree with Pedro, because then it shows that air filters is not enough, because in Sweden the pandemic is havocing completely in schools as well, and they don't have masks. Maybe in some very, very special schools, but in general there are so many members that are from Nordic COVID, and unfortunately Sweden is a notorious case of a bad example, unfortunately. So I have to, and Johnny, yeah, exactly, has written just that. So
Thank you. We are done now. The other session is starting.